Hello, everyone. Thank you guys for joining us this afternoon. My name is Adrisha Thomas. I'm with the Fairfax County Office of Human Rights and Equity Programs. We're just going to give folks a few more minutes to sign on. As you know, technology issues do happen in the age of COVID, so we're just going to give folks some grace. But we do want to thank you for taking the time this afternoon to join us, and especially our colleagues from across the region and the EOC and OSHA. So thank you again, and please, I appreciate your patience. Hello again, this is Adrisha Thomas with the Office of Human Rights and Equity Programs here in Fairfax County. I just want to give a quick update if you're just joining us. We're just giving a few minutes for folks to join. We'll probably get started at 3:05, but I just want you to be aware if you just happen to hop on in the last minute or so. Thank you again for your patience.
Hi, everyone. It's Jean.
Hi, Jean.
I can't get on, so I had to call.
Okay.
Okay, thank you, Jean. Sorry about that.
We're happy you're here.
I got disconnected, and it just keeps buffering. It keeps saying connecting, and it won't. But I'll keep trying. I've got 2 gizmos going. So I'm here.
We're just going to get started at 3:05. We're just allowing time for folks to join.
All right.
So hopefully we can connect. It'll work itself
It
out.
just keeps saying loading live event, and it doesn't stop doing that. Oh, there I am. But join as presenter. Should I push that?
Yes.
I'll try that. It says connecting again. But we'll see. I'll hope.
Cool. Okay.
I
So
see myself.
Hopefully it works out. But we are at 3:05, so we're going to get started here. Again, my name is Adrisha Thomas with the Fairfax County Office of Human Rights and Equity Programs. Thank you all for joining us. Hopefully you can hear me right? Okay. So a few logistics, some housekeeping that we want to cover. This meeting is being recorded, just FYI, and we will try to put it on our website as an office for folks who were not able to join this afternoon. But please be aware the meeting is being recorded. It will be available publicly. We ask that you also keep yourself muted except when talking. And also, please submit questions through the chat box. And if you could, please use your raise your hand feature to ask a question during the Q&A. That'd be awesome. So here's a quick look at our agenda. We're going to do welcome and introductions first for about 10 minutes. Then we're going to turn it over to Monica Colunga from the Equal Employment Opportunity Commission. And then we'll turn it over to Brett Bill with Occupational Safety and Health Administration before going into Q&A. So I'm honored to be joined by our colleagues across the region who will share about their office in a few moments. We have Jean Kelleher, who's the director of the City of Alexandria's Office of Human Rights. We have Gurjeet Chima, who is the director of the Arlington County Office of Human Rights. We have Monica Palacio, who's the director of the District of Columbia's Office of Human Rights. We also have Denise McPhail, who's the Outreach and Education Coordinator for the Prince William County Office of Human Rights. And as I mentioned previously, my name is Ajayesha Thomas. I'm the Outreach and Communication Specialist for the Fairfax County Office of Human Rights and Equity Programs. So what is the Fairfax County Office of Human Rights and Equity Programs? So our mission is to promote justice, equal opportunity, inclusiveness, and by protecting the civil rights of all in Fairfax County, whether you live, work, and play in the county. If you feel that you've been discriminated against, you can contact our office via our website, which is fairfaxcounty.gov/human rights. You can also call us and talk with an intake specialist for free at 703-324-2953. TTY users use 711. Next up, we'll turn to Jean with the Alexandria Office of Human Rights.
Good afternoon, everyone, and welcome. I'm sorry you can't see me. My iPad is still connecting, so I'm on my phone doing old school. The Alexandria Office of Human Rights was created by ordinance in 1975, along with the Human Rights Commission. I am the director, and the code was amended and expanded later to provide protection on the basis of sexual orientation in 1988 and familial status and housing matters in 1991, and most recently adding gender identity and transgender status in 2019. The office can receive, investigate, mediate, make findings on, and conciliate complaints of discrimination, really allegations of discrimination of any kind that occur within the city limits. We staff the Human Rights Commission and the Alexandria Commission on Persons with Disabilities, and we lead strategic initiatives to ensure that everyone who lives in, works in, or visits the city can share in the quality of life of the City of Alexandria. We value our relationship with the EEOC Washington Field Office, serving with my other colleagues who are on this call as fair employment practices agencies. So thank you for joining us today, and we look forward to the presentation from the EEOC and OSHA.
Thank you so much, Jean. Next, we'll turn to Gurjeet with Arlington County Office of Human Rights.
Hi, everyone, and welcome. My name is Gurjeet Chima. I'm the Assistant County Manager for ADA, EO, and Human Rights for Arlington County and the Director of the Office of Human Rights. Similar to what Jean just mentioned, our office also serves as a FEPA, Fair Employment Practices Agency, and partners of the EOC on outreach events during the year, such as this one. We handle accommodations based on disability and religious reasons, as well as EEO investigations, both internally and externally, so from employees and applicants, as well as from residents and those who work in Arlington County, whether that's in employment, housing, credit, education, and other bases. We also serve as support to our Human Rights Commission. In fact, decisions we render from complaints under the ordinance are appealable to that commission, which is appointed by the board. And that's the Human Rights Commission. We also serve to support the EO Standing Committee, as well as Disability Advisory Committee and the Commission on the Status of Women. And then we also, of course, similar to what Jean was mentioning, lead strategic projects across the county to promote and support diversity, inclusion, and equity in the county. Thank you so much.
Awesome. Thank you so much, Gurjeet. Next up, we're going to go to Monica with the DC Office of Human Rights.
Good afternoon, everyone. It's great to be here with my colleagues. Again, my name is Monica Palacio. I'm the director of the DC Office of Human Rights, and I like to think of us as one of the most progressive, most expansive anti-discrimination agencies in the country of its kind. We were, of course, created by the 1977 law, the DC Human Rights Act, and we enforce a number of local statutes, more than I can list in less than 5 minutes, as well as federal statutes. And according to our work sharing agreements with the EEOC and HUD, we also investigate cases referred to our office and try to move those through our process as quickly as possible. A couple of unique things about the Office of Human Rights in DC. We have mandatory mediation, which I know is not a common feature in a lot of the FIPAs, but I think of it as one of our most successful programs. Sometimes as high as 1 out of 2 cases are settled through mandatory mediation, and the rest go through full investigation at the office. Similar to the other agencies have described, our agency staffs and supports the Commission on Human Rights, which has up to 15 public members appointed by the mayor. So I'm thrilled to be here today, and I'm looking forward to our discussion.
Thank you, Monica. Next up, we have Denise of the Prince William County Office of Human Rights.
Good afternoon, everyone. I too am delighted to be here with you for this webinar with my colleagues across the region. Welcome. Also joining us from Prince William is Miss Andrea Brenner. She's employed as Prince William's Benefit and Retirement Division Manager in Human Resources. And the mission for the Prince William Human Rights Commission is to eliminate discrimination through civil and human rights law enforcement and to establish equal opportunity for all persons within the county through education. We too handle cases in the areas of employment, housing, credit, public accommodation, and education on the basis of race, sex, color, national origin, religion, disability, age, sexual orientation, and military status. Although our office is 100% virtual right now, you can contact us through our website, which is pwcgov.org/human rights, or you can call us at 703-792-4680 and speak with an actual live person. Thank you so much for sharing a part of your day with us, and have a good day and enjoy the webinar.
Thank you so much, Denise. We're going to go into our presenters. We're fortunate to be joined, as I mentioned earlier, by Monica Colungo, who's the Outreach and Education Coordinator for the U.S. Equal Employment Opportunity Commission. After Monica presents, we're happy to be joined by Brett Bill, who's a compliance assistant with the Occupational Safety and Health Administration. I'm going to stop sharing my slides so Monica can share hers. So thank you guys again for your time with us. And I look forward to the webinar myself.
Good afternoon, everybody. My name is Monica Colunga. It really is a pleasure and an honor to be here with fellow colleagues from our different FIPA offices. Our partnership with them is very important, and I thank you, Ajayesha, for putting this webinar together, and I'm happy to go over this information and to answer any questions at the end. So without any further ado, I'll go ahead and start. This presentation is on employment rights and obligations during COVID. First slide, it's just talking about EEOC, and we are a law enforcement agency, statutes that we enforce. Well, one of them is the ADA and the Rehabilitation Act. And this statute, it provides for reasonable accommodation and non-discrimination based on disability and establishes rules for employer medical examinations and inquiries and confidentiality of medical information. I will be touching a little bit on these areas further down in the presentation. The ADA applies to private employers with 15 or more employees and to state and local government employers, employment agencies, as well as labor unions. And Section 501 of the Rehabilitation Act applies all the same non-discrimination standards of Title I of the ADA to federal agencies. Okay, some other laws that the EEOC enforces includes Title VII. And under Title VII, protected bases includes race, color, national origin, religion, sex, which includes pregnancy, sexual orientation as well. We also have the ADEA, which covers, which prohibits discrimination of those employees or applicants over the age of 40. And then we have our most recent statute, which is GINA, prohibits discrimination based on genetic information. It's important to note that all of our statutes have a retaliation component to it as well. Other federal laws as well as state or local laws may provide employees with additional protections. There may be more coverage with other agencies, state and local. EEO laws continue to apply during COVID-19 during this pandemic. However, these laws, they don't interfere or they don't prevent employers from continuing to conduct business. You will be able to find much information about EEO laws and COVID-19 on our website. We update information as necessary, and you can just go to our website, eeoc.gov, coronavirus. And on there, you will find helpful information such as what you should know about COVID-19, the ADA, Rehabilitation Act, and EEO laws. That information was last updated September of last year. We also have pandemic preparedness in the workplace. That was updated in last year as well. And we also have Ask EEOC, which is a recorded webinar, and this was actually made available soon after the pandemic started. It was in March 27th. So if you want to view a webinar, it has expert attorneys from the EEOC, and the format is a Q&A, and it's a really good format. It's easy to follow, and if you don't want to watch the webinar, you can also get a copy of the transcript as well. All of these are resources found off our website and available to the public. So this presentation, what I'm going to do is cover some key points from the technical assistance materials that are available. Please remember that federal laws as well as state or local laws may provide additional protections. And this presentation is limited to federal EEO laws only. And it's really important that managers and supervisors consult their own employee policies and procedures as well. So first of all, let's talk about screening and the ADA. So the ADA does place restrictions on disability-related inquiries and medical exams by employers. They cannot make those types of medical inquiries or exam before an offer is made. Post-offer, it is allowable if it is applied to everyone in the same job category. For current employees, only if the exam is job related and consistent with business necessities. And it's important to keep in mind that the employer must have a reasonable belief based on objective evidence. Employee will pose a direct threat. And you hear more about this direct threat with the pandemic, right? It's basically a direct threat is a significant risk of substantial harm. More on screening during COVID. Currently, anyone entering the workplace that has symptoms of COVID could pose a direct threat to the health of others as defined under the ADA. The ADA does allow for employers, if they choose to screen all employees for COVID when they physically enter in the workplace. Again, this is something that is directly as a result of this pandemic. An employer is, as we have seen, some employers do, take temperature, ask about symptoms, ask if the person has been exposed to anyone with COVID, and administer the viral test for COVID infection. One important note here is that that does not include testing for the antibody, right? It's only tests for the virus, but does not include the antibody testing. Here are some best practices. Employers may instruct employees to stay home, as many of us telework now, or send them home if there are symptoms of COVID. They can also exclude employees from the workplace if that employee refuses to undergo screening measures. But keep in mind, it's really important to try to get cooperation from that employee and ask them why they don't want to be tested. And you can also, an employer can also remind the employee of confidentiality, of how that will be maintained. And it's also important to address accommodation requests that are related to screening measures as well. Let's talk about CDC high risk and high risk persons and age. So an employer cannot automatically exclude from the workplace those who do not have COVID, even if they're at a higher risk for severe illness if they contract COVID. So an employer can't deny employment because of COVID, due to age. Like, let's say, oh, this employee, they're older, they're more susceptible to get COVID, we're trying to keep them safe. Because that would be doing what? It would be making an employment decision based upon age. So under the ADA, it prohibits adverse employment decisions based on an individual's age of 40 or above. It does permit favorable treatment for those that are over 40. That's important to note as well. So let's talk about pregnancy and high risk. An employer, again, cannot automatically exclude from the workplace those who do not currently have COVID, even if they are at a higher risk for severe illness. The Pregnancy Discrimination Act prohibits employment decisions based on pregnancy, and in some cases may require providing pregnant employees with an accommodation provided to non-pregnant employees who are similar in their inability or ability to work. Now, this slide is on high-risk persons and disabilities. The ADA can require accommodations for pregnancy-related disabilities, again, absent an undue hardship. But it's important to note that disability, a pregnancy in itself, is not a disability. It's also important to note to exclude involuntary employer who would have to analyze and show that the employee poses a direct threat to herself or a high standard needs to be met. And even then, exclusion in the workplace is only allowed if there are no accommodations available. Here's some more information on inviting requests for accommodations. An employer they're free to provide information to the entire workforce about who to contact, that point of contact for an accommodation for disability or for flexibility or modifications. Employer can also invite advance requests even before the workplace opens for those employees who may choose to make an early request. That's also a good idea. And if employee chooses not to request in advance and instead request at a later time, the employer must still consider the request at the time that the accommodation request is made. So again, just some really good best practice tools available. So let's talk a little bit about confidentiality and the ADA. With limited exception, the ADA requires employers to keep confidential any medical information that they learn about an applicant or employee. Again, this is not just the employee, but also applicants. Medical information includes not only a diagnosis or treatment, but also the fact that an individual has requested or is receiving a reasonable accommodation. That's really important to note. That information should be kept confidential. And here's another thing that many employers aren't aware of, that those records should be maintained separately, medical records and personnel files. They should not be kept together. More on confidentiality, it restricts who employers can inform of the employee's COVID diagnosis or symptoms. They can inform officials designated to handle responses. They may inform health authorities. If informing other employees or customers, they cannot disclose the name of the person that has the COVID, but they can give a general description. For example, someone on the 3rd floor was recently diagnosed with COVID. That's fine. You just don't want to list the person's name because that would be that would go against the confidentiality. And it requires employers to keep confidential any medical information, such as taking temperatures. Sometimes employers will take temperatures of those employees entering the workplace. All that must be kept and logged and kept confidential, as well as symptoms or testing. Now, this next slide talks about reasonable accommodation under the ADA. And we all know that a reasonable accommodation are any adjustments or modifications provided by an employer. Again, to enable a person with disabilities equal employment opportunity. If a reasonable accommodation is needed and requested by an individual with a disability to apply for a job or to perform a job or enjoy benefits and privileges of employment, the employer must provide it unless it would pose an undue hardship. And what does that mean? Undue hardship means significantly difficult or expense. Now, an employer has the discretion to choose among an effective accommodation, and this happens during the interactive process where there's the communication back and forth with the employer and the employee. When there's a reasonable accommodation, when it results in an undue hardship, the employer must offer an alternative accommodation if one is available, again, absent an undue hardship. And I like to share this information about JAN. They have Job Accommodation Network. They have many resources available about accommodations in the workplace with just about any disability. So that's another real good resource. If you're looking into accommodations, you can even put in the person's disability, and it has a lot of examples and information about that disability. So I really like to share that resource with everybody. The employee may be entitled to accommodation for disability that places the employee at high risk for COVID, or for a disability that is exacerbated by the pandemic situation. And it's important to keep in mind that those designated essential or critical workers can still retain the ADA rights, and therefore they are entitled to accommodations for disability, regardless of their designated title of essential or critical worker. It's also important to note that the ADA's duty to accommodate generally only applies if the employee makes the request and has a disability. Also note that an employee is not entitled to an ADA accommodation based on employee living or being otherwise associated with another person with a disability. And at this time, the EEOC has not addressed if COVID-19 may render someone an individual with a disability under the ADA. I know sometimes I've gotten questions about this, but as of right now, there has been no we have made no decision on this as of yet. So let's talk about reasonable accommodation assessments. An accommodation, again, is to allow individuals to be in the workplace, and also for those maybe who cannot be in the workplace and where there's alternatives like telework. Employer does not need to eliminate the essential functions of the job as an accommodation or provide accommodation that would pose an undue hardship. So about telework. If an employer recalls an employee to work, request for continued telework as a disability accommodation need not be granted unless the ADA requirement is met. An employer can restore essential functions if they were temporarily altered due to the mandatory telework. Whether telework was effective during the pandemic, conditions may be relevant to deciding the employee's request for telework after the workplace reopens. So let's talk now a little bit about the interactive process. An employer should engage in the interactive process with the employee when there is a request made for an accommodation. An employer may request medical documentation. It's fine to ask for that. If it's part of the interactive process, if it has to do with a job accommodation. Employer has the discretion to choose among effective accommodations as well. Now talking a little bit about infection control requirements. An employee may have policies requiring employees to wear protective face masks or again to adhere to infection control practices. I know we're still seeing this happening. An employer may need to accommodate employers who need modifications or can't comply due to a disability, a religious belief, or subject to undue hardship test under each statute. I know for individuals that may be deaf or hard of hearing, maybe a regular standard mask doesn't work. And I know right now that there are masks out there that are clear that people can see through. That would be an accommodation for somebody with that type of disability. Now, a little bit on harassment and COVID-19. As we all know, when this pandemic first started, there was more reportings of an increase in reportings of harassment against Chinese or individuals of Asian national origin. It's really important to remember that any type of harassment based on protected class such as that is prohibited. So it's important that managers, supervisors be aware of what's happening in the workplace, and to also be aware that harassment can occur whether employees are in the workplace. It can also happen when they're teleworking or on leave. It could occur in the form of emails or phone calls or video chats, our new platforms of communication during this pandemic. So once again, best practice, managers should know their obligations if harassment is reported or observed. And employers should remind the workplace that harassment is prohibited and it can result in disciplinary consequences. Doing this gives the employees a sense, or it actually makes the workplace safe, right? Where people feel that if something does happen that breaks company policies, the action will be taken. So these are some really good best practices that employers should take. Now let's talk a little bit about the vaccinations. A lot of people have questions now that the vaccines are available. It's important to keep in mind that the vaccination in itself is not a medical exam. And pre-vaccination medical screening questions are likely to elicit information about disability. So just be aware of that. If an employer requires employees to provide proof that they have received the COVID vaccination from a pharmacy or their own health care provider, the employer may want to warn the employee not to provide any medical information aside from the results, just to make sure that you're not getting more information that you need to. And again, there's more information about the vaccines on our website, what you should know. A little bit more about vaccines and the ADA. Managers and supervisors are responsible for communicating with employees about compliance with employers' vaccination requirements. They should know how to recognize an accommodation request for an employee who has a disability and to know whom the request should be referred to for consideration, right? That's just informing their employees. And employers and employees should engage in a flexible, interactive process, right? To discuss an effective workplace accommodation and options that do not constitute an undue hardship. So under Title VII, let's look at mandatory vaccines. Once an employer is on notice that an employee sincerely held religious belief or practice or observance prevents the employee from receiving the vaccination, the employer must provide a reasonable accommodation for religious belief, practice, or observance. Again, unless it poses an undue hardship. And then on vaccines and GINA, which is Non-Genetic Information Non-Discriminatory Act, administering the COVID vaccine to employees or requiring an employee to provide proof that they had received the vaccine does not implicate Title VII of or GINA because it does not involve the use of genetic information. However, if you have pre-vaccination medical questions, those are going to be more likely to elicit information about a disability, or they may elicit information about genetic information, such as questions regarding the immune system of family members. So you have to be aware of that. And one last thing, again, on religion and GINA and the vaccines. Again, if an employer is aware that the employee has a sincerely held religious belief or practice, the employer must provide a reasonable accommodation unless it poses an undue hardship. And that includes an interactive process and having that conversation with that employee, respecting their beliefs, practices, and trying to find a way to accommodate that employee. And with that, I want to thank you for your time and attention, and I look forward to questions at the end. So now I'm going to go ahead and end the slideshow, Ajayesha, and send this back to you. Okay?
Let me unmute myself. Thank you, Monica. I'm going to start my slide point again. So Monica from the DC Office of Human Rights can talk about their leave policy. So let me bring up the slide. Let me bring up Monica. Oops. 1 second, you guys. Thank you for your patience. I'll bring up Monica. Let me see if I can share my screen to bring up the slide. And can you guys, oh, are you just seeing Monica, not the screen?
We can see the slide.
Okay. Oops. It's not live. And Monica's. Let's send that live. Okay. Okay. So that should be going.
Great, thank you, Ajayesha. You want me to jump in?
Yes, please do.
Okay, thank you. Good afternoon, everybody. I have 2 minutes to explain all of these words on this one slide to you. So I'm going to go rather quickly, but I'll be here at the end if you have questions. So there are a number of different protections in the district for paid and unpaid leave during COVID. These vary based on the public sector versus whether you work in the public sector or the private sector, the size of the employer. Some of them have requirements in terms of qualifications to be protected under the statute. So there are a lot of variables here. I'm going to start with the DC Family and Medical Leave Act of 1990, which provides unpaid job protected leave if you've had 1 year of service and 1,000 hours worked. So there are a lot of details here, but you get 16 weeks of medical leave and 16 weeks of family leave if you need to care for a seriously ill family member during a 24-month period. So under this statute, COVID-19 can qualify as a serious medical condition depending on its severity and how long the employer is sick. So moving along now to a statute we affectionately call CSEA, the Coronavirus Support Emergency Amendment Act. This also amends the DC Family Medical Leave Act and amends the Accrued Sick and Safe Leave Act of 2008 to provide unpaid leave. It's job protective leave for COVID-related reasons during the declaration of the public health emergency. And as far as we know right now, this statute is set to expire in May of this year, and the City Council is working to extend it. I'll now turn to universal paid leave, which is for private sector employees of any size who've earned wages in the preceding year, and provides 8 weeks of paid leave to care for a seriously ill family member, or provides leave to care for yourself. I believe it's 2 weeks for self and up to 8 weeks for a family member. So this one is a little more complicated, and sorry, it's a little hard to read. So yes, it's 8 weeks of paid leave per year, 2 weeks for yourself and 6 weeks for a family member. It's not protected leave, but there is a retaliation prohibition element included. And lastly, the Government Family Leave Program Amendment Act of 2014, where DC government employees receive up to 8 weeks of paid job protected leave per year to care for a seriously ill family member. And it also says DC government employees receive 13 days of paid sick leave per year. So as you can see, the District of Columbia provides broad protections, mostly under the unpaid job protected leave category. And I'll stop there because I'm sure that's been 2 minutes, and we can take some questions at the end.
Thank you so much, Monica. Let me stop sharing, and so we can go to Brett from OSHA. But we'll take questions at the end, and keep the questions coming in the chat, you guys. Thank you so much.
Okay, it should be here. Why can't you see it?
Oh, I can see your slides.
I can't see them.
Oh,
I don't know what happened. If I move this, can you see them moving?
I see your cursor moving, yes.
There we go. I can see it now. So my name is Brett Beal. I'm a compliance assistant specialist. I'm out of the Baltimore, Washington area office. Basically, I'm going to go through this kind of quickly. It's just some guidance on returning to work. But these guidance that I'm talking about, you can use them in your everyday life, like if you're going to the grocery store, if you're going to the mall, or wherever you might be going, even to the Quick Mart, or just even store, or even just going to a religious thing of a church or something. If you're using that, you need to just take precautions, and that's kind of what I'm going to go over. We do not have standards for any of this, so that's why we call it guidance or guidelines. Where do you turn? Where do you get information? There's all kinds of information. You're being bombarded all the time with it. One of the things we call them, these are short acronyms, but what they stand for is job hazards analysis, job safety analysis, and hazards analysis. Believe it or not, I know these sound like they're big things, but we actually do it in the course of our day. When you're just even walking across the street, you ever look, you look both ways, you look at the sign? Well, you just did a hazard analysis of what you were doing. We're asking you to do the same thing when you're going to work. You perform one, and then you're going to look at it, and you're going to look at the job hazards and what people are doing. Or if people are to provide you with services, are they providing you everything you need? You know, the comprehensive facility surveys, all the buildings have done them, but are you aware of them? Have they passed this information on to you? Have they changed it since the first day? I know probably since last year in March to now, we have changed things immensely. Routine job hazard analysis, those are things you do every day, but they're actually living documents. You need to look at them or look at your procedures that you do every day and identify things. We have all kinds of tools. We actually have a COVID-19 resources guide. As on this one, it says the 7th month, but actually it's been coming out every month since then. And I just received the current one yesterday. So if you're interested in this document, you can email me. My email will come up at the end of all of this. And it's a great resource guide. And also what's nice is it's in a Word document that you can open up and click on it, and it'll take you to the resources so you don't have to go hunting. These are some publications that we have available for you: Guidance on Returning to Work and Job Hazards Analysis. Both of these are available at OSHA.gov, which you'll see at the end. When you do a safety analysis, you probably need to write it down. What is the task that you're doing? In some cases, it might be just walking to your cubicle or to your office. And then what do? You showed up at the front door. What did they do? Did they clean it? Is the security guards doing what they need to do? So you want to look at the hazards. Most of the hazards you have with just going into a building is what we call touch points. What things do you have to touch to get where? And then what controls are they doing? If somebody says they're cleaning things, are they cleaning them on a regular schedule? Are they cleaning them after work? Like, for instance, in my office, one that we came up with is with the copy machine. If every time somebody uses it, when they get done with it, they actually wipe it down. And we have the equipment and the stuff there to do it right there on the job site. Guidance for returning to work. We have all sorts of publications and books. This is just one of them. They're all available on OSHA.gov, and you can download them for free. Guidelines for all phases of employers. Social distancing, we know that has to be done. How are you maintaining the social distancing? How do you keep that? You talked about temperature checks a few minutes ago, testing isolated areas. Contact tracing, if somebody does come down with it and it happened at work, can we figure out all the places that person might have been that day? Of course, sanitation, that should be done on a regular basis anyway, not just due to COVID. And there's more. We need to mark and identify things. People need to be reminded. We can't just say, hey, stay 6 feet. You've been to a store, you've been to stood in a line somewhere, and we have these things on there. Why? So people know what they need to do. It's a reminder. We had to do the same thing, like when I talked about that copy machine. We actually put a placard up behind the copy machine and to remind people to wipe it down. It only takes a second just to do that. So you also want to work on keeping those safe distances. OSHA fact page, we actually have it updated all the time. If workers are wearing face coverings, do they still need to be apart from each other? Yes, they do. We still want to do social distancing. You hear it every day in the news. If you're wearing a mask, most of the time when you talk about federal, they actually, the government, like with OSHA, they talk about respirators. We don't really talk about masks that much because they're not regulated under us. If they're wearing cloth or face, these are nice couple slides. If you get these are nice to have just to remind yourself. Cloth, paper, mask, what to do. How long do you keep them? How long should you wear them? How do I dispose of one? Do I just put it in the trash? You need to have those type of setup for what you do. The only thing about the cloth ones, well, leakages occurs around the edges because what? They're not tight fitting, right? And they do have limited use. Plus you can't laundry them. So probably it's a one-day use or a one-time use. Surgical masks, everybody's seen those. They're a little bit different, but they're also the same limitations as we just talked about with the other one. Who should wear them? Are they tight fitting? No, they're not. Do they have to have a check? You can't really check them because of them being loose fitted. And again, where do I dispose of them and where do I get more of those? A filtering face piece. This is what OSHA kind of gets into. Respirators, they're N95s. Those sometimes look like a mask, but they're white and they have a little exhalation valve on the front. Those time you get into. Those are tight fitting, believe it or not. And yes, they have fit testing requirements. There was some exemptions that were given, and those were for people in the medical fields. Temporary enforcement guidelines. This is what we were just talking about. Additional regarding fit testing, they did come up with some restrictions and some in the regulations that allowed people to not be fit tested. One of the other things they always talk about too, and I understand this one, is washing our hands. We all were taught this at a young age that we need to keep washing our hands and using our hand sanitizers and stuff. Is hand sanitizer available in your place of work? Do you carry some with you? You know, and also too, what's some of the precautions of hand sanitizers? I don't know if you've ever had a cut. They tend to burn quite a bit on a cut or something like that. So those are, make sure that you always have the warnings up too also for your hand sanitizers. These are some devices that you'll see here. They've been put on doors. Why? Because we're trying to cut down the contact points with our hands, our skin. We don't want to be touching things and getting it on our skin. When we tend to get it on our skin, what do? We touch our hair, we touch our eyes, we touch our face, we pick up food, we grab a chip or whatever. So you want to have that. These are some devices that you can put on them. As you can see, the one down there for the floor. There's ones that hit your arms. Some of them also slide over the ADA handles and can give you more to be able to push it down with your elbow and all. And then of course the foot grabs. What surfaces should be regularly cleaned? Well, all the surfaces that get touched. You know, from in the restroom to the spigots to our sinks to our tables. Are we still going to a break room area? Was the break room right down? I saw a really unique thing the other day. It was about tables that was used. They had a block. It was painted green on one side, red on the other. So if you sat down, if you went to the table and it was green, that meant the table was wiped down and the area was clean. And if it wasn't, the red was up and it meant somebody needed to clean it. I thought that was such a simple device that somebody came up with, but it works so well as far as to make sure, like if I walked in, do I know if that table's been clean? And this was a way of identifying it. And then, of course, all the other things that we talk about. We have our cell phones, our computers, microwaves, copy machines. What surfaces we need to get them clean and wipe them down. Now, how do we go about cleaning those? Well, we need to have house cleaning. Is the cleaning, if you have a company doing your cleaning in your building, are they up on all the levels of how to clean everything? Do they know what needs to be done? We know they've done dusting and wiping in the past, but what are they doing? Anything up and above? What is their plan? That might be something you want to know. And they need to have a written cleaning and schedule. So you know exactly what they're doing, or who's in the building, or who's around your spaces. You know, and most of the spaces are saying everybody has to wear a mask when they go in the space, but are they also following your guidelines? Cleaning and disinfecting. Well, we all know about how to clean. We're going to wipe things down. Has anybody ever bought those little cleaning wipes that you find out that you can buy? You know, there's many manufacturers out there, and they're great for wiping down surfaces, and then you can easily dispose of them. One of the things I happen to learn through all of this COVID, that those things have contact times. And what that really means is when you go to use those products, such as these, you have to leave them sit and soak for a few minutes. Some are more, some are less. It depends on how long. I know in the past, I used to wipe a table and then I'd come right behind it with a paper towel and wipe up the wet stuff because I thought it cleaned it. But come to find out, I was actually taking the disinfectant part away, that it needs to be left. It's actually on the containers, or you can go to like NIOSH and you actually can look up some of these things. Another one is 6 steps to stay safe and effective. One of them is check that your products are EPA approved. You want to check that. I know that come into play when sometimes some places were making some homemade ones, but you can actually ask them how they made it and they should have it all wrote down. Read the directions on the containers and the products that you're using. Another one is also follow the contact time. You know, that's what we were just talking about. How long is the product? And that comes with sprays and everything that you might be using. And also wear the gloves. Don't just use your bare hands when you're doing it, because you're wiping up something that you feel that's contaminated. You might be then exposing yourself. And then of course, keep our products safe and away from everybody else. Stop the spread of germs. You know, we want to tell, these are posters that are available for you online. The CDC has those out there. They're for free. The one on the right is from MOSH, so you can actually have that available for you. That's Maryland Occupational Safety and Health. But you can go to all of these websites and get these posters. You can print them out in 8.5 by 11s, or some of them will actually send you the full-size poster. So do post it and get the information out to people. Again, what we're doing is reminding them. Mark the floors. As you can see on the right there, there's a nice fancy sign that they purchased, but the one to the left, basically painter's tape, it looks like. And then you identify the areas and travel when we're in a space. Keeping it, especially when some of your places, they do get kind of small, especially when we have cubicles and those type of environments. We want to make sure that we're keeping that social distancing. Here's another way. You know, we've seen these when we go to our bulk stores. They always have these little banners set up. Create a flow of travel, and then especially in hallways and items like that. This next picture shows all kinds of places. We have stairways, steps, elevators. When you go into an elevator, don't go to that full capacity, right? You want to make sure that you keep your social distancing. So we're an elevator, we all can remember getting in some of those in the last second and we're jammed in there like little sardines. Well, we can't do that anymore. So you might have to wait a few times to actually get the elevator. So we don't want to do that. Also wiping down our surfaces. It's like when you go through security, you know, with your badge and you might be putting it in. Are they keeping that area clean? Because lots of times people are just touching things. The elevator itself. Is the elevator being wiped down periodically? Is there a schedule for an elevator? Remember those touch points, those buttons on there. How many people are pushing the buttons on the elevator to make it go to where it needs to be? So you can think about it. This next one shows another elevator. I don't know about the idea of the foot the making you face the wall. I think that's a little bit bad, but I thought it was very humorous just to say, well, I guess they're taking it. You've noticed those people weren't wearing masks in that picture, and I guess maybe that stops some of the coughing or exposure that way. Then you'll see the one over on the left there. Those are actually pretty nice, that they're actually in the 4 corners of a small elevator. Another one, again, is our stairs, making sure that people go up and down, maybe left to the right or right to the left. I know a lot of people like to exercise with the steps and go up and down them, but we also want to always keep our social distancing happening. Workers, all workers have the right to a safe workplace, and that's why we're doing all this. We're going to raise our safety and health concerns with all of these things that we're doing, but we need to follow up with them. We need to come behind and look at what we do. Have we done the right thing? And remember, when you make up a document such as a hazard assessment, it's a living document. It's going to constantly change. It's going to need to be reevaluated, especially as more and more if we start bringing people back to the office. Right? A lot of people are still staying home, but once they start to return, we're probably still going to keep some of that social distancing in there. This is basically my information. If you ever want to email me or send something to you, this is the where you would get my information from. Again, I'm a compliance assistant specialist in Baltimore, Washington area office. I cover all of Washington, D.C. and all the federal property in Maryland. And I do quite a bit actually down in Virginia as well from time to time. And that's it for my presentation.
Thank you, Brett. Thank you, Monica, for presenting. I'm going to, or time for a question and answer portion for everyone. We got some questions, a lot of questions about, will the presentation slides be shared? So Monica and Brett, are you fine with sharing your presentation slides so I can put them on OREF's website?
Please have at it. The other one that I wanted to show was the COVID-19 resources. It's the one you saw on there. And if anybody wants that, do email me and I'd be more than glad to send it to you, or I could send it to you and then you could distribute it or however you all would like to. They just updated and it's a great, easy document to use. And it covers CDC, NIOSH, OSHA, all sorts of things are actually in there. The Food and Drug Administration's actually in there. And it talks about everything from cleaning to PPE. It's a great resource document for everyone.
Okay, awesome. Thank you, Brett. So that covers a question that I saw multiple times. I'm just going to start back at the top. A lot of questions came in when Monica was speaking from EEOC. So I'm going to send you live, Monica, and go back up. So the question is, we have had a complainant argue that their employer wanted to take their temperature with an infrared forehead thermometer. They argued that they had a religious objection to having a device pointed at their forehead and asked for a religious accommodation. Would this be a valid religious accommodation request?
It sure sounds like it to me. It does, and I'd recommend seeing what other option the employee has in mind.
Okay, thank you so much. Our next question. Can an employee request to continue teleworking due to COVID because they are over age 65, even if they do not have an underlying health condition?
That's a good question. Under the ADEA, there is allowance for more favorable treatment for people that are 40 and above. So technically, that's a valid request, and that's something that the employer can speak to the employee about. And if it's available, I would say so.
Okay. Someone asked, is it true we are now being required to wear 2 masks?
I have no information on that. I'm sorry. I don't.
There has been guidelines put out from like CDC has put it out and other local jurisdictions have put it out. I know like in Maryland, the governor actually put it out, those type of things like that. You know, again, I don't know who would be to say to do the enforcement on that part, but yeah, there was stuff that was put out from that.
And it was my understanding that it's like helpful or suggested to wear 2 masks.
Okay, cool. Thank you, Brett and Monica. So another question, are employers required to continue to provide a pandemic-related accommodation, such as telework, for someone who chooses not to get the vaccine?
So does an employer still have to provide an accommodation?
Such as telework.
Even though the vaccine is now still available?
For someone who chooses not to get the vaccine, yeah.
That's a good question. Why is the person choosing not to take the vaccine? Is it for a religious reason? Is it due to a disability? It depends. It depends on the reason why.
Monica and Ajayesha, this is Jean.
Sure.
I've done a little bit of research on mandating vaccines, and I think right now, because we're in a position where the vaccines have not been fully approved by the FDA, that although the guidance is that an employer can mandate a vaccine. It's advisable not to at this time because of all the legal ramifications. But you're absolutely right, Monica, that there should be a discussion as to why the person is refusing to take the vaccine. So the emphasis should be on encouraging the vaccinations, not mandating them, and then have those conversations, because this is a burgeoning area of the law.
Thank you, Jean.
Thank you, Jean. Okay, so the next questions, I think it came up during Brett's talk, if I correct with my timestamp. So it says, in a healthcare facility, can we make the vaccine mandatory? I think we covered that kind of with the last question, sorry. How do you all define employer for all these rights and obligations? Maybe that's still Monica, I'm sorry.
That's all right. They had time to think.
So I know Fairfax County employer is considered, they have to have, what, 5 or more employees in the county? Monica, how does the EOC define employer?
I'm sorry, is that the question? What defines an employer?
Employer, yes.
For each statute, it's different. The required employee, like for the EPA, it's just 1 employee. I know for some, like the ADA, I think it's 20 or more. So it depends on which statute we're talking about.
Okay, thank you. Sorry about that. And then we have a question, DC specific question. That's for Monica. Do the DC COVID FMLA amendments provide 16 weeks of COVID leave in addition to 16 weeks of medical leave and 16 weeks of family leave? Oh, can't hear you. I think you're on mute.
Sorry, I was muted. Got it. Darn. I try not to be that person, you know? So yes, the answer is yes. However, it doesn't reset every 24 months the way that the medical and family leave do. So yes, it's 16 weeks for the duration of the emergency.
Okay. Thank you. We have another, I guess, EOC related question. Can I ask to be vaccinated as a requirement for employment if necessary due to the nature of the job?
Can a person be asked to be vaccinated?
Yeah, as a requirement for employment if necessary to do the nature of their job.
Good question. Can they be asked? I think they can be asked, and they can provide proof that they've been vaccinated. That's allowable. If the employee chooses not to be vaccinated, again, it would have to be, why does the person not want to be vaccinated, and having that conversation with that employee.
Thank you so much. Next question. I think this is for you, Brett. It said, when you said the outcome of the facilities evaluation should be shared with you, in what way should employers share that evaluation result and how much detail?
What I look at is when they should share it, because you're doing a document that involves everyone. That's why I call it a living document. And then also when we do a job hazards analysis, it can't be just from management's perspective. It must have the employees also perspective, you know, because sometimes management might not be in all those spaces at all the times and not see the intricacies of something. So they should be part of that. And that's why it gets reevaluated periodically, you know, with changes. I know, like my office, we went through a lot of changes, not allowing certain people in the, you know, all the time and things like that, and making sure that we only have 2 people because we're a very small spot. So we had to come up with something. And then it does get shared with the employees because they're going to know what the rules are. Also, a job hazards analysis can be used as training also. So it can work both ways. If I do a job hazards analysis and I have everybody review it, I use it as a training, and then employee can't come back and say, I didn't know anything about it. I didn't know. So they're using that as also the document of the training. That's like on that one I showed you, that form where it goes through 3 sections. It can be used as a training document too. So it helps. And then sometimes when you present it to somebody, says, well, what about this? You didn't talk about, say for instance, we were covering all the machines, right? And we left out one. Somebody's going to know it, right? Somebody's going to say, you didn't say nothing about the fax machine, so we don't have to wipe it down. No, we really meant all machines, but you know, just so you get it in there. That's all. It happens.
Thank you. I think this is a comment or a question. It says DOL OSHA is working on some type of guidance to consider at workplace given the current vaccination process. Maybe are you working on some guidance considering?
The only thing they're working on is a national emphasis program right now. We did have a presentation earlier today about that, but that's really going to come down to on enforcement side and stuff when people are not pursuing the avenues that they should be taking. And that's what it was really about. And also what our compliance officers should be looking. That would be a national emphasis program, you know, that they put out, that they have it. They are now looking into that instead of using guidance to actually come down with that means we'll have temporary enforcement, as you folks in Virginia already have. When this COVID happened, remember they implemented temporary enforcement, and then they came along and said, nope, we're going to leave it in there. And that's about what it is.
Thank you. Next question. If employees are working around unmasked performers, non-medical, does PPE N95 in parentheses need to be provided in addition to social distancing?
Well, if they're in medical, they all should be wearing N95s. That's what they use. They don't really, we call it, and it looks like a mask, but that's an N95 respirator. Even though it's white, it has 2 straps, it looks like it, but that's what they're actually being provided. Now, the other people, like what we're using, and you'll see people they look like surgical masks. There's not the same thing. A surgical mask really stops for whatever you have inside you going out to someone else, but a respirator stops things from coming into you. So.
Okay. Thank you. Next question. Can someone, for example, a restaurant worker, be fired for refusing a COVID vaccination? What if they say they can't for medical or religious reasons? I think that's more Monica, EOC.
Or any of the partners. I think that's a request, right? That's a request for an accommodation. So again, we need to have a conversation and find out more information, begin that interactive process. Jean, if you want to add, or anybody else?
Yes, that's that same situation. So for right now, try not to mandate them, have the conversation as to why the person is not, is not in compliance. But keep it voluntary and keep the encouragement going, and don't actually cross the line into mandating at this time. Until this full FDA authorization, it's a real problem.
Thank you. Next question is, if I feel unsafe at work because my employer is not requiring face masks, should I call OSHA?
Yes, you can call a complaint in on that. If you're in Virginia, of course, you're going to contact VOSH. If you're in Maryland, you're going to contact Maryland Occupational Safety and Health. If you're in any federal installation or all of Washington, D.C., you call OSHA. And all of those on their websites, if you type in those acronyms, you'll get their site and it says file a complaint. And then you'll get a number and a signed thing, and that's what will happen. Yep.
Awesome, thank you. We have some email addresses in here. People want the slides, we'll get those to you guys. As I said, I'm happy to put them on the Office of Human Rights Equity Programs website. So they'll be up there along with the video recording of this webinar. Someone asked, any news about tax credit for employees who pays sick leave after March 31st? I'm not sure who's that.
That's not mine.
Okay. Might be a different agency. If an employee is sick for a few days, are they required to have the COVID test? I I don't think you can require anyone to get tested, Monica. Is that correct?
No.
Monica? Yeah. Okay, an ADA question. Can an ADA request that contains medical information be shared with the employee's supervisor and or chain of command?
Again, it depends on the work. If it should really be need to know only basis, the information that's being shared. Usually there should be a human resources or a point of contact. So the less people that need to know is probably better, just to make sure that, you know, confidential information is not shared to people that don't need to know.
Cool. Thank you. So we have 2 questions listed here. I think this will be the final 2 because we are over time. It's 4:11. So I'll just go with these last 2 questions that are already here. If an employee receiving accommodations plans to get the vaccine, however, requests to continue telework as an accommodation until more people are vaccinated, is this reasonable?
I mean, it could be. It could be. Every place is different of employment, but it could be. And again, that includes a conversation with the employer and the employee.
Thank you. And final question that's been submitted through the chat box. What penalties are there to employers who refuse to allow an over 40 employee with chronic conditions a telework accommodation? Telework has been offered previously to all non-operational employees.
That sounds like a job for all of us.
Okay.
Okay.
Jaysha, could you repeat that again real quick?
I said the question is, what penalties are there to employers who refuse to allow an over 40 employee with chronic conditions a telework accommodation? Telework has been offered previously to all non-operational employees.
Yeah.
Get a discussion.
Yeah, have a discussion or contact one of us, you know, or, you know, seek help, you know, contact the FEPA, contact the EEOC. Just because you contact the EEOC doesn't mean you're going to file. Maybe it's talking about the situation with an intake officer or an intake officer at any of these local agencies to get more information, more detailed information about what's happening at work, and then deciding what they want to do.
Cool. Well, thank you guys. Thank you all so much for joining us. I think that's all our questions for now. I want to thank again my colleagues from across the region, Jean from Alexandria, Gurjeet from Arlington County, Monica from DC, Denise from Prince William County, and Andrea Brenner also from Prince William County. And especially our presenters, Monica Kalunga from the EOC and Brett Bill from OSHA for all their time and energy to make this event possible. This was a team effort. I'm glad that we were able to all collaborate in this manner, and hopefully we can do it again at some other time, and I'll have a better sense of how to use Microsoft Teams by then, or someone else can host, and that'll be even better for me. Yep. But I thank you all tremendously so much for giving of your time and energy to share this important information with the residents that we serve across the National Capital Region. The work that we do is important, and I hope that everyone realizes that we are here to be a resource for you and your families. If you feel that you have been discriminated against in any way, there are protections, new protections here in Virginia that went into effect July 1st of 2020. And of course, DC has so many protected classes. Like if something happens to you in DC discrimination wise, like call Monica's office and they'll get on it, right? So you have rights regardless of your immigration status, regardless if your ability to pay, right? It doesn't matter, you can file a complaint for free. And we are here to be a resource for you. So again, the slides will be available on fairfaxcounty.gov/human rights on our website. In addition to this recording of this video. Thank you guys again so much for your time, and have a great week, and please be safe.
Be safe. Take care now. Thank you.
Thank you, Jaysha.
Yeah.